So, hi everyone, welcome to the UCL Chemical and Physical Society's evening talk this week. Thank you very much for registering and showing your interest. And I'm now going to pass to Dr. Tamara Al-Hifi, who's going to introduce our speaker for this evening.
Hi everyone, so we welcome Dr. Rohin Francis, who is a popular science communicator with a large following on his YouTube channel, Medlife Crisis. And Dr. Francis trained as a physician in London and Cambridge, specialising in cardiology, and is currently undertaking a PhD here at UCL in the Institute of Cardiovascular Science. His talk tonight challenges the kind of junk science that's been published and the lack of clear science communication during the pandemic. So yeah, I'll pass over to Dr. Francis. Thanks.
Hi everybody, my name's Rohin. I'm a cardiologist, as you just heard, and perhaps UCL's worst PhD student because I'm moving at a glacial pace, but very proud to be invited today. Thank you very much to the organizers. And I also did my BSc here many moons ago, and I'm sure most of you were in primary school. And looking at your illustrious previous speakers, I feel a little bit of a fraud because I'm far from a proper academic, and I'm really only on people's radars as a vapid social media influencer type person, making these medical science kind of related videos online. And indeed, that's what I'm here to talk about is how we talk about science. And I know that it's a little bit different to some of the talks you've had before, but I thought this would be something that anyone from a varied science backgrounds might find something relevant and useful. It's not a science communication 101. I don't think I'm a particular expert at that at all. It's more just a look over the last sort of 12 months from the point of view of a practicing clinical doctor who's been talking about the pandemic in a sort of public space online. And I think, you represent a generation of scientists that are graduating and entering starting your careers in science with an understanding of how important science communication is. And I think it's much more common now, and we'll kind of come on to that in the way that science, as the culture of science, has kind of contributed to where we find ourselves today. But I think, it's fair to say that most of us don't get any formal training in how to talk about science. And I certainly don't think that everyone who is involved in science needs to be a science communicator and have it as a major part of their career or anything like that. But I do think that it's important to understand some of the skills that are involved, even if you have no desire in doing anything in a public setting. Talking to one another, that's still science communication, talking to scientists from different backgrounds. And of course, all of you that have applied for grants know that you have to fill that box saying why the public should be interested in the research you're doing. So this is all different types of science communication. And I'll start, I'll start by kind of laying the groundwork about the problems we find ourselves in, and not who's to blame, but the different parties involved. And you might come away thinking that because I'm critical of the scientific community, I think that they're the key culprits in the confusion that has sort of ruled for the last 12 months or so. And I'm not suggesting that. There are multiple different parties at play here, and the media and politicians, I think, are far more culpable. So I'm not giving them a free pass, but I think it's important for us as scientists to be introspective and to analyze our role here. Politicians, particularly in this country and the US, have genuinely failed at many roles. But one of the key things that would have been wonderful to have from the government is clear science communication. The media, I don't think any of us have come to expect much from them these days. They are motivated by clicks and attention, and so that's all I'll say about them for the most part. And so just to say that I'm not ignoring their role in this, and I don't think it's any coincidence that the countries that have got science communication right are the same countries that have got their response to the pandemic right and are doing much better than we are in the UK. A lot of the Asian countries that we've heard that are success stories, Korea, Taiwan, Hong Kong, Vietnam, they had much clearer messaging. And something I thought was quite striking was Jacinda Ardern, who in New Zealand, again, another country that's dealt with it in a successful manner, actually specifically thanked science communicators, which is something that I'd never actually seen a world leader do. So what is the kind of problem that I'm talking about? Well, COVID-19 has, of course, been a situation like nothing any of us alive have dealt with before. And there's always going to be some fear and confusion with this unprecedented situation and a level of scrutiny in medical science that none of us will have experienced. But I don't need to tell any of you that somewhere along the lines, things have deteriorated to give us a situation where it's almost impossible for the average citizen to figure out the truth. And you've got legions of people who don't believe in lockdowns or masks. I'm not saying they disagree with them as policy choices, that at least is defendable as an opinion based on values. And I think it's important to say that, you know, science can't give us all the answers. Some things do have to be based on values, which science can't, you know, can guide us maybe. That's not what they're not expressing opinions. They're genuinely saying that they think that masks and lockdowns don't actually work, which is, you know, fundamentally factually incorrect. So, you know, we've got people endorsing unproven therapies, people saying that hospitals are empty. They can't all be kooks. You can't say that this is all the work of some sort of lunatic fringe with a concerted disinformation campaign. And to say that ignores the role that scientists themselves have played in adding to the confusion. The phrase that first made me, you know, really facepalm was following the science. And, you know, that's one I'm sure you've heard the government say on many occasions. And this gives this false impression that science is a kind of monolithic machine, like Deep Thought in The Hitchhiker's Guide to the Galaxy, that just spits out black and white answers to very complicated questions. And of course, that's not how science works. None of you here need to be told that. And the harm from this comes when more data emerge and then a scientific position changes and it's refined. And sometimes it can change quite drastically, and that's fine. You know, we all understand that's how science works, but the public come away feeling almost gaslighted. If they're being told that at one point by the government that, you know, the employers have a right to fire you if you don't go back to work, and then sometime later they're saying, you know, why can't you work from home? Or if they're saying eat out to help out, and then telling people that they should maintain their distance at all time and not attend public places, this just leaves the public feeling that they've been lied to, or you know, nothing is making sense. And if there's no justification, there's no explanation, you're not telling them the why, then they naturally get dubious. So let's go back to the beginning. Just over a year ago, no one had heard of COVID. For me, I was quite hesitant to start talking about it online. I didn't feel that it was really my field. Obviously, as the weeks progressed, there was no escaping it. It was becoming all encompassing. And, you know, I was then getting directly involved by treating patients. And I thought, you know, maybe I should start talking about this. I can maybe be of some use. And I also have a lot of friends who felt that as the government really wasn't stepping up to the plate and wasn't being clear, they thought that it was their duty to try and help. So they wanted to say something. And the great advantage of struggling with imposter syndrome is that I was conscious not to overstep my expertise, but sometimes fate conspires against you. I'll explain why in a second. But instead of sort of giving my hot takes on complicated virology or public health, I thought that maybe my role would be to try and make some videos about how to think about the pandemic from a kind of different perspective, how to make sense of some of the numbers. But before I knew it, you know, and I started this YouTube channel really just as a bit of fun, not to do anything serious. I specifically chose topics that weren't particularly clinically useful. They were just interesting things. So, you know, I'd gone from that and saying that I don't think I'll make any videos about COVID to ending up on the national news and twice and Radio 4, all within the space of a few weeks. And even though I went and I said in advance, I really don't want to be asked anything that makes me appear like I'm an expert in COVID itself. We had a nice interview about the kind of things that I wanted to talk about, and then I'm going to change the slide. I hate looking at that picture. I was told, I was asked on air, what is a continuous cough? What do the government mean in their guidelines when they say that? I think I managed to blag my way through it, but I came away with some learning lessons from that. Number one, live TV is way more scary than anything on YouTube, where I've got editorial control. And the media, once they've got your contact details, they will go to you for things that are well outside your realm of expertise. So for the next few weeks, ITV and BBC would call me up to ask about my thoughts on shops closing, on schools opening, whether COVID's airborne, intensive care, bed capacity in the NHS. And I didn't feel comfortable talking about any of this stuff. So I said no. And as soon as you start doing that, they lose interest and they find somebody else. To a journalist, getting somebody with credentials is a coup. It gives their piece more authority. So you've got to be very careful. And this is something that will apply to any of you in your own field. You've got to be careful what you agree to say, because the viewers will automatically see somebody with a title. They'll see doctor in front of your name. And irrespective if you're an orthopedic surgeon or a professor of biochemistry or a doctor of chemistry, none of those people may have any experience dealing with infectious disease, but they'll see that and they'll think that person knows what they're talking about. And so you've got to decide yourself, where you draw the line and what you feel comfortable talking about. And I think there are ways to do that. You can present yourself not as an expert, but someone trying to figure it out yourself. But often that's difficult if you're not the one in charge. If you're going on to TV or radio as a guest, I think that's something that you really need to think about in advance. Unfortunately, a lot of my colleagues are more than happy to go on air and talk about things outside their sphere. I guess presumably drawn by their chance to be in the spotlight. There have been some very high profile people who have done that. I'll mention this chap. I don't know if any of you recognize him. He's become a big star online, certainly, and has ruffled quite a lot of feathers. A lot of people in epidemiology and public health really feel that he's not got the relevant experience, and he's gone from about 2,000 Twitter followers to almost 500,000. His name's Eric Fagel-Ding. I don't really want to highlight him in particular, but he is certainly a very prominent person who represents this kind of phenomenon. And trying to stay within your lane, that certainly doesn't make me unique in any way, but there are other people. There are enough people who do what's come to be known as epistemic trespassing, and this is a term coined by Nathan Ballantyne, one of the co-authors of that top article there. You may recognize his co-author there, David Dunning, from the Dunning-Kruger effect. And Nathan Ballantyne had coined this term epistemic trespassing, which kind of has some overlap into Dunning-Kruger. Those of you who don't know, without going into the whole debate about whether it exists or not, I think it's just a useful shorthand to describe overconfidence in a field where you don't know enough to realize that actually you shouldn't be that confident. I think that probably explains it fairly succinctly. And this is a kind of related phenomenon of having expertise in one field and then thinking it applies to something else, and that's what this term refers to, of epistemic trespassing. And I don't know if you can really describe Trump as someone who has knowledge in any field and trespassing into another, but certainly Elon Musk, who clearly is an expert in some things, really was a key culprit in going well outside his area of expertise and doing untold damage. I mean, I really have been very disappointed with how he's talked through the pandemic. And this has problems when it comes to public health, because of course people's lives are at stake. And if you don't have certain prerequisite knowledge in a field, you can end up making mistakes that are really basic to anyone within that field. for example, I'll give you a sort of very obvious example. Comparing lung cancer, say in Nigeria or the UK, and saying that, well, there are higher rates of smoking in Nigeria, but there are lower rates of lung cancer than the UK. So smoking must be protective against lung cancer. I don't know if these stats are definite. I'm just making this up, but you know, it's obvious to anybody that there must be something else going on there, confounders. And comparing countries' health outcomes is notoriously problematic for all these kinds of reasons. You know, for example, in that case, it could be that Nigerians are dying at a younger age from preventable diseases like infectious disease that we don't have in the UK, and British people are living to an older age and hence getting higher rates of lung cancer because Nigerians are dying too young to actually get the lung cancer. So that's an obvious example, but there are more subtle ones. And, you know, we've seen this with things like vitamin D, that a lot of people who are not experienced in looking at this population-wide data have been able to access data sets that are publicly available online. And you all know that you can chop up data anyway and come up with spurious findings and mistake correlation for causation. Oh, I've gone to that slide a bit too early. I've given you a sneak peek of, but it's probably best I don't leave that one up too long. Talking of research in general, one of the, you know, the worst knock-on effects of the pandemic has been the cessation of all other areas of scientific research. I'm sure a lot of people listening today have experienced this firsthand. And so a lot of scientists found themselves with nothing to do. And I guess this is a way of understanding why this epistemic trespassing occurred. It's not necessarily out of any malice. You know, I actually consider myself very lucky that I had a pretty simple role. You know, I went to work, I knew what I was supposed to do. My own research has taken a back seat, but you know, I'm in clinical work. So myself and all the other healthcare workers in the NHS kind of had a pretty straightforward last 12 months in terms of knowing what our place was. But a lot of scientists were stuck at home and felt, you know, they want to contribute, and that's entirely understandable. So they repurposed their research, and often this was fantastic. You know, I think it's not an exaggeration to say that this truly was the greatest worldwide collaboration of scientists that since the war. And you know, we have made incredible progress with vaccines. We have now got several vaccines in use, almost ready for use, which is just breathtaking if you know it, even the slightest thing about how long vaccines normally take to develop. Which is not a demonstration of cutting corners. That's a testament to this incredible collaborative effort from geneticists, biologists, chemists, data scientists, mathematicians, physicists, and loads more. They've all brought their expertise to the table. However, at last count, I found over 100,000, about 102,000 published articles on COVID-19. And that doesn't include preprint servers. So maybe that same number again, I'm just guessing, but something like 200,000 odd papers have been written about COVID-19. No matter what field of science, a tenuous link to COVID could be found. And worse still, the duplication has been ridiculous. Replication in science is normally a good thing. But when you have 232 trials, separate trials looking at hydroxychloroquine, the drug you can see Elon and former President Trump endorsing there, this is a complete waste of time. I'm not saying it shouldn't have been investigated, but 232 trials looking at the same drug is a complete waste of time. And so we've also seen a disappointing rise in something called science by press release. Instead of being able to see the full papers from the start, we're now getting announcements of carefully selected results, generation of hype, and there have been a lot of serious scientists cheerleading for some of this stuff. And I get why, you know, we're all keen to have something. I think it's a bit less excusable at this point. Early on in the pandemic, I think it was more understandable that we just wanted something to work. But now we're still seeing it happening. And just last week, an example, there was a drug published, a trial published about a drug called colchicine, which is an old drug which has been around a long time. And we got a press release that looked really exciting. We thought, wow, maybe this is the next tool in the armament. We had dexamethasone, another old drug last year, the first drug that really make a difference, but that's for quite severe COVID. So this colchicine was promising to be something that could treat less severe COVID, people who aren't necessarily in the hospital. And we got a press release and we got an abstract, and it all sounded really exciting. And then finally the paper came out, and it was just monumentally disappointing. And it led to this graphic doing the rounds online. The memes have been one of the benefits of the pandemic. I'll move on from that slide. I don't want to leave up gratuitous topless men. So, even at this stage, we're still committing the same mistakes, getting way too excited about data that isn't all there. Other trials that have been done, to think that these 200,000 odd trials or papers are all of a good quality is pie in the sky thinking. And a lot of them have been just way too small from the start to produce any meaningful results. So just don't bother. Don't waste time doing trials that are never going to give useful data. They're just going to add to the noise. And instead of promoting randomization into and recruitment into clinical trials, which is the most powerful tool in medical science, doctors were adopting a kind of kitchen sink approach, throwing everything at patients, giving 6 different treatments at once and hoping that something worked. But of course, that just means you don't know if the patient got better. You don't know if any of them worked, or if one worked, which one was it? And I was really aghast at the things that doctors were saying online, openly saying that they were giving unproven medications and coming up with their own regimens, publishing protocols based on nothing more than opinion. And parallels were drawn to HIV/AIDS in the 1980s and saying, it's unethical to withhold treatment, and we shouldn't be randomizing patients into trials. But that is, missing a key point, that the mortality from HIV/AIDS at the beginning was 100%. There was nothing to lose. So of course, in that kind of scenario, you don't want to be in a placebo arm of a randomized controlled trial, but that's not the case with COVID-19. So we know that just trying this kind of kitchen sink approach wasn't correct. And actually, here in the UK, I think we should be very proud of the recovery trial, which wasn't the first to publish its results. It took its time. It recruited across the country. It's a tremendous success story of the NHS and the NIHR. And after a lot of other people were publishing kind of half-baked results, it came out with that first success story, which was dexamethasone. Ed Yong, a science writer I'm sure a lot of you have heard of, who's an absolute beacon of superb science journalism amongst all of this, highlighted another example of kind of epistemic trespassing, which was 2 biogeographers who published a paper saying, one of the 200,000, saying that the tropics wouldn't be affected by COVID, not realizing that they were using a model that was more used for animal species and vector-borne diseases, not viruses. And so it gave the impression that the tropics are just not going to be so badly hit. And the impact of this, it was quite early on in the pandemic, has been extremely pervasive. And I still talk to people who think that hot countries just don't get affected by COVID. And of course, a large proportion of countries between the tropics are developing countries. And this kind of thinking that they're not going to be affected has been hugely damaging. So my unscientific estimate for the proportion of COVID research that's even worth reading out of that 200,000 is probably 10% at most. Peer review, I should probably give a trigger warning to a group of scientists. Peer review is a flawed process at the best of times, but here we were seeing truly awful papers sail through, which is not necessarily surprising because journals were being inundated and we were all getting requests for peer review. We just couldn't keep up. And so sometimes I think papers were being published with maybe one set of eyeballs having seen the paper before it was actually in the journal. And the aforementioned preprint servers, where previously one could publish work and it would be looked at by your colleagues, a bunch of scientists, and then, you know, there'd be a bit of discussion about it. You could critique it, revise it. That's all gone out of the window. Now, preprint servers are being poured over by journalists, often with very little understanding of, you know, beyond just regurgitating the abstracts, which a lot of the time are pretty sensationalist. And in the same way, you know, some have suggested that for these preprint servers, you need to accompany them with a kind of plain text explainer, like a journal might accompany a study with an editorial, sort of giving a little bit of a summary. But when the authors themselves are the ones hyping up their own work, I'm not sure that really solves any problems. So if you upload a study that is deeply flawed, suggesting that hydroxychloroquine works, that smoking protects against COVID, that asymptomatic recovered patients have serious heart disease, that only 10,000 people are going to die in the United States, or there's not going to be a second wave, then ordinarily you would be torn to pieces by your peers in the time-honored tradition that is central to science. But now it's on the front pages and it's around the world within hours. This was the French scientist Didier Raoult who published that incredibly flawed initial hydroxychloroquine study, which just became this behemoth of misinformation endorsed by those celebrities that we've already seen. And to further emphasize the point about traditional peer review not necessarily being any better, you know, the traditional system is maybe 2 or 3 individuals will review a manuscript. A lot of the worst papers were not on preprint servers. Didier Raoult's was published in a journal. And the 2 biggest medical journals in the world, the New England Journal of Medicine and the Lancet, were forced to retract 3 papers published using a fake database from a company called Surgisphere, who turned out to probably have faked all of their data. And these were enormous publications with massive implications. And frankly, the signs they were fake were glaring. They were quite obvious to anyone. And yet they got published in, you know, the medical equivalent of Nature and Cell. These are the top 2 journals. And it was only when people just on Twitter took them to pieces by just showing that this data couldn't possibly be real. So in a way, it's been quite interesting to see the scientific process that normally takes place behind closed doors played out in public. You know, the public are used to hearing from scientists at the end of the scientific process, but now they're hearing from us in the middle as it's unfolding, which is something entirely new. But with this public demonstration of the machinations of medicine, its problems have also been exposed, and it seems to be more toxic than ever. So talking of Twitter taking that those faked studies to pieces, it kind of brings us on to social media. Now, one could argue that science journalists themselves should be able to appraise science. And I think that's true to a large extent, but maybe that's unrealistic. And science journalists often have to cover very disparate fields, so they can't be expected to know everything. They do rely on experts. And, you know, maybe some of you will be those experts that journalists will call. And we saw the rise of this kind of semi-celebrity or celebrity science communicator online. And some have been worth their weight in gold and have done truly incredible work in their spare time on top of all their work. Some of these people are you know, neck deep involved in the pandemic response in their own countries. And they've gone the extra mile and really taken time to try and explain things online. But others have sought to use COVID as a way to raise their own profile. We've seen social media medics explode. You know, multiple epidemiologists have gone from sort of sharing things with a few friends in their little public health and epidemiology circles to now having hundreds of thousands of followers. And they kind of fall into different camps. As you know, on social media, the more extreme your position, the greater your reach is. And so we've seen on one side the kind of deadly fearmongers who say things like, deadly strain and deadly new strain, and you know, it's all going wrong, or breaking news, it's way worse than you think, we're all going to die. And on the other side, we've seen trained scientists sowing doubt on the right side of the screen there, cherry picking data, posting completely biased opinions that the risk is negligible, lockdowns are ineffective, and so on. I included, I mentioned Eric Fagel-Ding at the top there, but Eric Topol is a fellow cardiologist. He's probably one of the most well-known cardiologists in the world. And I'm blocked because I suggested that he might be sensationalizing some of the data, but there you go. That's just a marker of where we are in scientific debate. And you know, this sounds a lot like politics, doesn't it? That you get these different camps, and unfortunately, there has been a quite significant superimposition of politics on top of science, which again has just made the whole thing quite ugly. In terms of science communicators, you know, they fall into two groups. One that sees it as their role to kind of summarize and aggregate and explain data, and I think you know, that's extremely important. But then there's maybe the harder task of actually analyzing it and talking about that to a general audience. So the summarizers or aggregators can produce simplified versions of published info, or they can explain guidelines. And as I said, that, you know, I think there's nothing wrong with that at all. It's very important, but people may assume that you are an expert when you position yourself as a sort of public explainer of science, unless you specifically say you're not. And I think a lot of people have allowed the public to think that. And the problem is with that, you end up making subconscious editorial decisions, particularly on a medium like Twitter, where you have to be quite brief. So a paper might say, I don't know, so just, again, I'm going to make this up, but something like, you know, bananas found to reduce replication of SARS-CoV-2 using murine epithelial cells in vitro. You know, a real mouthful and quite boring. And the science communicator explainer person might say in a tweet, you know, promising news, bananas found to reduce coronavirus in mouse model. And then the newspaper will see that, because, you know, out of these hundreds of thousands of people following these science communicators, obviously a lot of them are going to be journalists. They'll see that and they'll say, and front page the next day will be, eat bananas, stop coronavirus and save the NHS. And then Boris Johnson will buy everyone a banana split. And you can see how it's a sort of game of telephone, and things get lost along the way. And try as we might, we all have our inherent biases. So if you position yourself as an explainer, it's really hard to maintain complete neutrality. But with so much COVID science being published, if you just repeat and summarize everything, you're going to end up giving contradictory information, because, as we've seen already, there's so much noise out there that you have to try and be a bit selective. If you don't question what you're reading, you're going to end up repeating falsehoods. Now, science communicators sometimes think it's all about sort of celebrating science, being really enthusiastic and sort of talking about the wonders and how amazing science is. But enthusiasm without some skepticism can actually be harmful in itself. So what happens when, oops, what happened to my slide here? So what happens when opposing sides of a debate collide? Well, hopefully in scientific circles, normally what results is a healthy discussion, but it seems like that is long gone. Now discussions are fairly bad-tempered. There's little tolerance for deviation from an accepted narrative. Scientists are having arguments in public, which can turn really ugly. This directly then plays into the hands of science deniers, and you know, they can then say, well, scientists don't really know what they can't agree, so that, you know, nobody knows what the truth is, and they ignore the fact that, say, 95% of scientists will think one thing and 5% will think the contrary view, and they'll paint it as a kind of 50-50. And a friend of mine, Simon Clark, who's another science YouTuber, he's a atmospheric physicist, told me something that I thought was really true, that climate science is just COVID in slow motion. Or maybe he said it's the other way around, but COVID is just climate science in fast forward. But he's absolutely right in that we're seeing the same lobby groups, we're seeing the same vested interests, we're seeing the same deliberate disinformation and misinformation, bogus science, obfuscation that we've seen before with tobacco and with climate science, and we've been ignoring it for decades with climate change. So it's not really surprising that we're seeing exactly the same phenomena. Sorry, I think my slides have come a little bit out of order here, but this one, I just put this in because I was looking up science communication and COVID and seeing what had actually been published about it. And I just thought it was quite amusing that one paper said, don't dumb it down, use jargon, and the other one said, don't use jargon. So there's an example even within science communication and COVID that contradicts each other. And my slides are not changing. Oh. Sorry, I think my slides have somehow come out of order here. You might have heard of the Great Barrington Declaration, which was a rather confused document, basically saying that lockdowns are more harm than good. It was authored by 3 bona fide professors of epidemiology and medicine, and their expertise is far more pertinent than someone like me when it comes to a pandemic. So why would a member of the public believe somebody like me, who's not got any specific expertise in the field, against 3 people with far more credentials? And that's a really difficult question to answer. You know, people have asked, well, you know, and this is something I read online a lot. It's like, you know, why are you questioning this? These 3 are Stanford, Oxford professors of epidemiology, and unfortunately, people with credentials have risen to the top of the groups of people that are spreading things that are far from evidence-based. Another example was Scott Atlas, who is a doctor, and he ended up being the White House main science advisor. And he was a doctor, yes, but he was a radiologist. He didn't have any specific experience in the field. But again, people see the credentials and they think, well, why should I believe one person over another? I guess the point I'm trying to make here is that these are not cranks. They are trained professionals, and it's very challenging to explain to a member of the public why one set of information is less reliable than another. Sorry, something's gone a bit wrong with my slides here. Another group of people you might recognize here, again, all boldly pronounce their own views, and all of these people are doctors, either PhD or medical doctors, and their words went around the world before they were denounced by their own professional bodies. And just that, like a removal of a YouTube video or a professional body saying that we disagree with these people, just feeds into the narrative that their believers have, that they're being censored and, you know, they're going against the kind of group think. And it's a self-perpetuating cycle. An additional problem with arguing over things like this, over things that should be obvious, is that more complex issues like, say, schools being open, where science can't give you a clear answer about what to do, because again, like I was saying earlier, there is a judgment call, there are values involved, becomes really challenging. And, you know, that's a field that I think it would be really useful to have a rational debate. But now it just degenerates, and I've talked to a lot of people who are directly involved in this, who are pediatricians, who are public health officials, who would love to have a proper discussion about this, and they just can't, because if each side strawmans the other, they say that if you propose opening schools, then you just want to kill everybody, and if you are in favor of keeping schools shut, then you are in favor of domestic violence and child abuse. So it's completely degenerated from a sort of irrational academic debate. Scientists themselves have felt the need to debunk information. Epidemiologists and doctors, professors, and so on have spent hours of their lives countering nonsensical information. One, I think, important lesson to draw from COVID-19 science communication is that countering misinformation, although needed, can itself contribute to confusion, particularly as the audience may already be overwhelmed by information and messaging from many different sources and outlets. When the public themselves cannot distinguish the expertise of information sources, then countering misinformation can seem like esoteric infighting. And this can result in the audience gravitating to individual groups or people themselves who they feel, with whom they feel the most affinity, who kind of share their predetermined values. So they're not really making their mind up. They're coming with a preconceived idea. They're just finding a cornucopia of different views, and they're saying, well, I might as well just choose the one that I agree with most. And that's really a failure of science communication. Scientists have found themselves contacted by news agents. So this, my slides are just pictures, so they're not particularly instrumental, but somehow they seem to have come out of order. This is about schools opening, obviously. Scientists themselves have found themselves being contacted by news agencies. And if you put yourself in a public position, you're basically opening yourself up for trolling and online abuse. And as I said earlier, I started making videos as a bit of a laugh. It wasn't really meant to be any kind of career-related thing. And I specifically steered clear of anything too inflammatory or serious. But as soon as you start talking about not just COVID, other things as well, diet, vaccines, you're open game. And it can be pretty unpleasant. I'm quite thick-skinned, but a lot of people who have been really targeted. And so this is something that you've got to bear in mind, depending on the field you're in, that you're putting yourself in that position. Another politically charged and complicated topic that I won't dwell on too much has been that of COVID and race. And it's been really hard to find accurate scientific debate about this, leading to well-meaning people who are trying to help, perpetuating ideas that really have no basis in science. And the pandemic overall has seen the disparity between rich and poor, it's seen racial disparities actually widen instead of improving. And that includes within science itself. We tend to have heard from the same voices, and we haven't necessarily got that same, got the diverse representation from within science that would have helped with a lot of these kinds of issues. So I guess now to take stand back a bit and take a wider view, what has been the main reason that a lot of these smart scientists have engaged in faulty science and bad science communication? And there, of course, have been plenty of reasons. As I said, we're ultimately biased human beings. We've got flawed brains, but I think I'd highlight two. First, the feeling that we need to get this out ASAP. Lives are at stake. We're in a pandemic. We need to rush and sort of publish ASAP. But without wanting to sound too blunt, that's not a reason to not randomize patients into a trial. Commission bias is this feeling that you need to do something. We can't just observe, we can't just gather data, we've got to do something now. And as I said earlier on, maybe it's defensible, but we're still seeing it. That culture scene paper, the one that I said was published and didn't have as exciting results as we'd been led to believe. The reason is that, and the author specifically said this, is that they rushed it out because they felt it was a pandemic and it was important to publish as soon as possible, which is really unacceptable, sort of 1 year into a pandemic. Because if they had just waited, like the recovery trial did, the British trial, a bit more, they would have got more data and the results would have been significant. What they actually published was maybe a trend towards benefit, but just not enough numbers to be a significant result. The second reason, I think, is the inability of the human race to deal with uncertainty well. We've wanted definite answers to complicated questions when they really don't exist. And unfortunately, a lot of the time, science hasn't been able to give those clear answers. But instead of accepting that uncertainty, I think the public has gravitated towards people who have been definite in what they're saying, and that's led to maybe that self-perpetuating cycle of people taking a more definitive stance on something, gaining more support, gaining more followers, and then drifting further and further to one extreme. So what is maybe the way forward from here? I guess the big science communication challenge ahead of us is going to be vaccines. It's all, you know, they've already begun. I'm very lucky to have got my first dose of the vaccine, but this is going to be something that is going to be with us for many, many months. And you know as well as me that there is an extremely loud, extremely aggressive minority of people who are vehemently anti-vaccine and anti-science, and who actively spread disinformation. So how did they get empowered in the first place? Well, again, I'm not sure there was a fringe group of anti-vaccine people going way back into the 80s. They've been around a long time. In fact, actually going back to Jenner's time, from the invention of vaccination. There have been people that have been opposed to vaccinations. It's quite a fascinating history if you look into it, but they were really just, nobody cared about them until this infamous paper that I'm sure a lot of you will know, published by a British doctor. Again, you know, this wasn't some complete quack, in The Lancet, the same journal that had to retract 2 of those blockbuster papers in the midst of the pandemic. And this galvanized the anti-vaccine community. And it was actually 13 years until the Lancet retracted it. So yeah, I can't lay the blame squarely at the anti-vaccine crowd themselves. The scientific community, the Lancet itself, the scientists that allowed this through, the scientists that were involved, the doctors and clinicians that were involved, they have all contributed to this. But now we find ourselves in 2021 with this very loud, very active anti-vaccine community, and unfortunately, it's spread to the UK. It may surprise you, actually. I did an event with Heidi Larson, who's the chair of the Vaccine Hesitancy Project, very inspirational person and a remarkable organization. And they've gathered data from 194 countries around the world about attitudes to vaccines. And you probably won't guess which country scores highest for vaccine hesitancy and sort of that anti-vaccine sentiment. It's not America, it's actually France. So it's not just a problem that we're seeing over in America. We've got the same people here. They're definitely in Europe. And you know, for generations, scientists have been told not to engage with the press, not to engage with the public, to be cold, dispassionate, clinical, to be, you know, that stereotypical image of a scientist. And we allowed people like the anti-vaccine community who appeal to emotion and ignore science, ignore facts. We've allowed them to gain traction. And we can't do the same anymore. We're something as emotive as vaccination. We can't just say, you got to do this. We've got to engage with people better. We've got to explain to them why, and give them the justification for why guidelines exist. Now, I don't really know the makeup of the audience today. I know there are some people that have come from me mentioning on the internet, but I'm sure the majority are from the usual UCL crowd and a lot of chemists. So I'd love to kind of find out. I'm afraid I've got a hard stop in about 10 minutes when I've got to go to my night shift. But I would urge all of you to at least familiarize yourself with some of the basics of science communication. And remember, you're talking to people. So try to connect with them at a level that means something to them. Much as it pains me to say, case reports, which are the lowest level of medical evidence, just accounts of individual cases or maybe small groups of cases, are not particularly useful from a medical evidence point of view, but they're what connects with people. And they make much more of an impact with individuals in the population than a meta-analysis or something like that. So whilst you must always stress that the importance of the quality of evidence and the different levels of evidence. It's something to bear in mind, that that's the reason that the anti-science community have been so successful in winning over hearts and minds, is because they have connected. They've been able to tell stories that I think has often been lacking in science. And some of the very inspirational science communicators that I look up to, heroes of mine, and I'm sure a lot of you as well, have understood the importance of framing things more like a story when talking to people. Be honest about science's shortcomings. Don't batter people over the head with sarcastic memes. I'll always defend memes, but there's a time and a place. And don't talk down to people. Open a dialogue rather than sort of delivering a monologue. Be ethical in your own conduct. Try and avoid hype. I think hype in science is a real problem. But most of all, try and cultivate trust. And I think if you do all of those aforementioned things, that will inevitably come. I think you will develop that trust. And contrary to popular belief, most of the public are not anti-science. They know that science can make their lives better. They're probably just not as into it as you or me, but explain to them why they should care, and they will. So I hope that was interesting. Sorry about the kind of muddle up of my slides in the middle, but they're really fairly ornamental, to be honest. When the society first got in touch, they were pretty open about what subjects I wanted to do. So I thought this would be something that would be hopefully relevant to people from different backgrounds. You can find me in all the usual places on social media under Medlife Crisis, and I look forward to hearing from a few of you. Thanks very much.
Thanks, Rohan. That was such an interesting talk and really fascinating. I think it's, it's very easy to, maybe on social media, you would see, I don't know, your mum's cousin or the school bully from your hometown posting rubbish, and to dismiss that, but to see it kind of played out in the science community, what we trust and believe in. Yeah, it's been really eye-opening. We've just got a lot of kind of compliments and thank yous in the chat. Did you say you've got to go in 10 minutes? Have you got time for questions? No worries if not.
Yeah, I've got maybe 8 minutes. Okay.
Does anybody have any 8-minute worthy quick question? We've got one in the chat from Kian. I don't know if you can read that. It says, covering the issues you mentioned around peer review and research quality, could it be a time for a radically new model for scientific/medical research? If so, do you have a view on what this might look like? Probably not very 8 minutes.
Yeah, I mean, I guess I can give a short answer. I don't know. I'm not an expert here. I kind of took a deep dive into the whole science publishing industry recently for a video a few months ago. And unfortunately, I think there are just so many problems with scientific publishing across all fields. A lot of that is to do with money. I think peer review, though, as something that we are more in charge of rather than the publishers, we as the scientific community, is just fundamentally, I think it's unfair on scientists to expect them to go out of their way to give up their free time to do all this work for companies that are profiting from publishing this, other people's work. They're not paying the authors, they're not paying the peer reviewers. And I've, like I think any working scientist have been involved with peer review, not a huge amount compared to a lot of my peers. And I am not under any illusion that I think my peer review of a paper is not going to be equivalent to, a professor who's a real expert in the field. And I just think it's a really erratic kind of uneven playing field. I think that peer reviewers should be remunerated. I think that maybe a model to go for outside of the kind of main journals. We've got so many journals now, and a lot of them, peer review is going to be meaningless. I think it's always going to be something for the top journals, but maybe we should move more to a kind of preprint model and have a kind of, I can't remember if it's medRxiv or bioRxiv, that has ability to comment and critique journals. You can post something there and you can get comments from other people. So maybe that is the model to go for. Of course, that already exists in the form of Twitter in many respects. And, you know, I've published work that I have put online on Twitter and got some fantastic feedback for. And I find that one of Twitter's main uses is understanding and analyzing scientific work. So maybe we need to move to a more kind of more social media-esque model where it's just open peer review.
Thank you. There's a really quick question. The RSM has been giving free webinar discussions in respect of COVID. Do you liaise with them?
No.
Easy question.
I don't think they know I exist.
And maybe another quick one is, what is your perspective on open science articles that are geared toward lay audiences?
I'm not sure what they mean by sort of open science. I mean, science articles geared towards lay audiences, yeah, I think are fantastic. I don't know if that's a specific thing, open science. Is that I'm not sure if that's in reference to something specific.
Yeah, it is, yeah. Oh, I don't know.
I don't know if that's a specific thing, but yeah, I'm afraid I can't comment on that.
Okay, well, we'll let you go to your night shift. Thank you so much for your talk. And I'm going to pass over to, is it Miranda or Chiara? Miranda, yeah. Thank you.
Well, thank you very much for your talk, and thank you for talking to our society, and thank you very much to everyone who turned up. I hope you enjoyed, and CPS actually runs talks every week. We have another talk later in February or possibly early March, which is another talk about science communication by Andy Extens, and he'll be talking about how to write science into people's brains. So if science communication is something you're interested in, that's one to have a look at. The rest of our events are also available on Eventbrite. We have a talk every Tuesday and some Thursdays as well. So yeah, thank you very much again for Dr. Francis for talking, and thank you for everyone for attending.